Hey, Angela.
Hi, Aly. So glad to be here with you again.
Me too.
Just to give a little bit of background, as folks may know, we're digging in deeper to your platform here with these little bit like longer form conversations.
Great.
So we've already had a great conversation about housing.
Yep.
And today we're here to talk about healthcare.
Yes.
And I'd ask you, so would you say that when you're out there on the campaign trail, it seems like healthcare is probably one of the things you're hearing most about?
Oh, yes. Healthcare, right? Healthcare and housing.
Yep.
You know me, I want to go to that root cause of what's really at the base of what's hurting Vermont right now.
Yes.
And tackle it in a way that's real.
Yes. And so, can you name for us, lay out the problem, what's going on with healthcare in Vermont?
It's a problem, okay? I think, again, you don't need me to tell you the problem as a Vermonter because you're feeling it every single day. Healthcare is strangling us. Our businesses, our individuals. All right, so we have the highest healthcare premiums in the country, which means we have the highest healthcare premiums in the world. That is unacceptable. Let me actually break this down to a dollar figure for you because I just had a conversation with a family. A family of four has a beautiful farm in southern Vermont. They are paying $25,000 a year on healthcare with a $16,000 deductible.
Oh my gosh.
So I asked them, so you're basically paying for catastrophic insurance. They're like, well, you would think, but not exactly because we needed emergency care the other day and couldn't get access in Vermont. So we had to go out of state and pay out of pocket.
Oh, wow.
So you're basically paying more than any other expense in your budget for nothing. This is unacceptable. So we have a massive problem in the state of Vermont. It goes from costs to affordability, quality, and access. And all three of those are related, and we have to tackle them like the emergency that it is.
I love that. That is very clear. Affordability, access, and quality. So again, I know you, Aly, and I have a feeling you've got a plan to address all three. So can you tell us a little bit more about that?
Yeah, what are we going to do about it? Look, we have to really focus up and understand what is in our control to change in healthcare in the state of Vermont. So, first we have to really move like we mean it to a system of universal access to primary care. So primary care is what is going to bend our cost curve. It's going to save costs by preventing, expensive medical bills for Vermonters, and that lowers costs for all of us. Okay.
Yeah. This is that sort of like you invest the dollars up front in that preventative care so that you're not spending them later on down the road.
Bingo. And what's even worse is that a lot of Vermonters can't even get access to primary care. Primary care, right? It's called primary care for a reason. So we really have, we're at about 10% of our healthcare spending on primary care, and every other country in the world that has this figured out is closer to 15%. And that's not just spending money. Nobody cares about how much money we spend. It's about access. It's about how many primary care providers we have. So we've got to grow it by about 25% to be on par with the countries that are actually bending their cost curves, keeping people healthy. All right? Yep. So that's a job for us. How do we do it in a way that works?
Yeah.
Workforce. We have to build the workforce of medical professionals. So how do we do that? We had a nursing shortage in Vermont and we turned it around. So we actually know, again, as usual, we know what works. We've got to just move in that direction. So loan forgiveness, rural incentive pay. You got to build a homegrown pipeline of primary care providers, docs, nurses, skilled nursing. We can do that right within our own educational institutions in Vermont. So career and technical centers all the way up to Community College of Vermont, the Vermont State College System, UVM, you name it, okay? We also have to get these primary care providers out of the business of chasing insurance. They got into this to be doctors and nurses, to care for patients, not to spend all their time on that. So we're working up a real plan that really lets doctors and nurses do the work with the patients,
right,
and stop having them spend all their time with insurance.
Right. And so we've got that will open up access, because you're talking about effectively looking for ways to increase the number of providers.
Yeah.
There needs to be some increase in the number of providers.
Yes.
And in specific locations.
Yep.
As well, because you're talking about rural incentive pay.
Exactly.
So it's really coming at it from all angles.
Yeah, and again, growing the workforce with tried and true strategies to do exactly that. It has to be our number one goal. And as you'll find as a thread, it's actually at the basis of most of my planks in my platform. We have a real workforce crisis in Vermont across the board, and it's true for primary care. So you really, really do need to focus on this. You also need to control costs, okay? So how do we really control costs? I think Vermonters know we have skyrocketing costs in healthcare that have actually gone from bad to worse in the last 10 years. We have become the highest healthcare premium state in the nation over the last decade, okay? We haven't had enough leadership on this issue from the top, okay? So we have tools in the toolbox, like reference-based pricing. I'm gonna get real in the weeds with you for a second.
Let's do it.
Reference-based pricing, it means hospitals cannot charge more than a percentage of Medicare. So it basically controls costs, puts a ceiling right on there. We've said we're doing that as the state of Vermont, and we really have no idea how we're marching towards that yet. We need a 3 to 5 year plan that gets us towards reference-based pricing without killing critical services, like the birthing center in Brattleboro is a great example. That's the example of a hospital making a tough choice because they're looking at bankruptcy, but it wasn't the right choice for the community. And with more of a plan that the state needs to provide some leadership on, say, all right, we need birthing services in this region. If it's not going to be Brattleboro, where is it going to be? And let's have a phased in plan with no community disruption, right? Organizing to thrive instead of scrambling to survive.
Yeah, and what you're talking about is, to my mind, some pretty basic coordination.
Yes.
That really does need to come from, leadership at the top of state government.
Look, every single other state has, many other states, I'll say, have figured this out. We are not going to be the first trying an experiment here. Other states facing the same high costs in rural healthcare have said, who's doing hips, who's doing hearts, who's doing this. But it has to be a statewide plan, or we lose quality, we lose services, and we literally lose these hospitals. For me, the question is not which hospital are we going to lose first. It's how do we do whatever is in our power to keep these hospitals open. They are jobs, they are emergency rooms, they need to stay open. And so this coordination among hospitals with the leadership of the governor is the way we're going to do that. And it's how we're going to move to really using reference-based pricing, in other words, controlling our costs into the future in a way that's real and doesn't bleed services in the meantime, every single month. That we can't live like that in Vermont. So I think this is really important. And I just want to say one more thing. The governor vetoed a bill that was going to take our first step to figuring out how to do reference-based pricing. It's hard to understand why. It was basically just I'm mad at the legislature, so I'm going to say no to this, for like a political point, when really the people in charge, including the Green Mountain Care Board of reference-based pricing, said, we don't know how to take the first bite of the elephant. Yeah. It's important, it's big, it's hard, so we got to start somewhere. Let's start with this group of lives and really figure out how to do this. And the governor said, nope, if it's not everybody, it's nobody.
Right, and frustratingly, that the group that was identified, targeted in that bill that was vetoed, S-190, was identified for the very reason that it was, you can remind us, education, folks in our public education system, working in the public education system, as well as folks buying private insurance on the marketplace.
Yep.
And we all would have saved money on property taxes.
Millions of dollars on property taxes. It would have been a step forward.
Yeah.
Instead of no step.
Yeah.
So.
Yes,
very disappointing.
Frustrating and disappointing. And sometimes another another sometimes frustrating aspect of healthcare, I think, is how much of healthcare sort of control is at, and influence maybe, is at the federal level.
100%.
So can you talk to us a little bit about that?
Well, yeah, I'd say if I was running for president, I'd be running on a plan for single-payer healthcare. We need it in this country, and it is frustrating that so many of our levers in healthcare are out of our reach in a fully broken system. But, you know, until we're ready as a country to make that major change, which I hope is very soon, and we can help accelerate it by doing something in Vermont that works, by the way. We've done it before in many areas, a couple I'm intimately familiar with, you know, so we can help that. But in the meantime, what can we do in Vermont? We got to maximize every federal dollar that is owed to us. We paid that money in while we're creating universal access to primary care, while we're bending the costs and controlling them on hospitals. We have to maximize every federal dollar that is owed to us. First is through Medicaid. 45,000 Vermonters could possibly lose Medicaid through the cuts that Trump just pushed through. Unacceptable. But here's the thing. They know what they're doing. They want people to get off Medicaid, so we don't have to pay anymore. That's ridiculous. But what they did was just create more hoops for people to jump through. People are no longer eligible. They just have to jump through more hoops. And so here's the beauty of this. That's where your state government can help you. Navigators out in communities. The legislature took a first step with this. Let's make sure it's working and supercharge it as much as we need. Because the truth is, every Vermonter who should be on Medicaid should stay on Medicaid, and government can help ensure that you're jumping through the hoops to stay on that coverage, okay? Those dollars are owed to us, to Vermonters. The second thing is, I don't think Vermonters know this. We're getting $195 million a year, starting this year and for the next 5 years, from the federal government to help us transform our healthcare system. Governor Scott doesn't have a plan to spend it. That kind of money is game-changing for the state of Vermont. It's game-changing. It can absolutely accelerate our efforts to coordinate among hospitals, to keep our hospitals open through that thoughtful, planful work, to transform primary care access through helping us build the pipelines for the workforce, you know, for sharing medical records across all hospitals, across the system, across primary care docs. There are so many things we can do to spend that money that is really going to transform what's within our power to change in healthcare in the state of Vermont.
Yeah. And, you know, as you're talking, I'm hearing certain themes or certain key words coming out, you know, things like workforce, coordination, you know, planning, developing. And I'm thinking, you've done this in a different sector.
Yeah.
Which brings me to the question that I like to ask, you know, in all of these conversations, why are you the right person to help lead Vermont through this tricky time and really bring us to a place, you know, of growth and, as you say, unlocking our potential?
Thank you for asking. Okay. I know how to set a goal. I know how to really understand what's at the core of what we're trying to solve and set that goal with Vermonters to say, look, we've got to bring our healthcare costs down. We've got to keep our rural hospitals open. We have to maximize the dollars from the federal government. You know, and we have to get everyone primary care. These are not, it's hard, but is within our reach, okay? So setting the goal and bringing Vermonters together, a coalition of folks who are most impacted and most expert on this, and setting deadlines and targets, and focusing until it is real. That is what I think I have shown my ability to do in the state of Vermont. And how do you do anything? You know, management experience, relationships. I really know who to put in the room from all walks of life. It's not just the loudest voice, you know, it's really who is going to bring us that deep perspective so we know when we take this move, it's really going to work on the ground.
Yeah, I'm thinking about how deeply involved early childhood educators were in the, you know, education, in the childcare transformation. And I'm very confident that our healthcare workers would be deeply involved.
100%. Doctors, nurses, LNAs, RNs, you know, folks at the FQHCs, folks in the free clinic. And I'm glad you brought that up. We need to expand our free clinic model. We have 8 of them in the state. We don't even have one in every county. This is the best money we'll ever spend. Right here in Barrie, the People's Wellness Clinic, just visited them a couple weeks ago. Inspiring. Really speechless. And it's hard for me to get speechless. I wish it was easier. And honestly, they are spending a couple $100,000 to offer free healthcare. It's mental health, it's dental, it's full-on life-saving healthcare for people that cannot be in the system, who do not have insurance, who are underinsured, who can't get up the hill to the hospital, and it is saving us millions of dollars. And it's building relationships and community, for
such a protective factor.
Unbelievable. So it's a beautiful thing. Yep. I recommend folks check out where's your local free clinic, and let's make sure everyone in Vermont is within a certain mile range of one, because just having 8, who cropped up in communities that decided we got to figure this out really is not how we should do business in Vermont.
Yeah. Well, as usual, Aly, every time we have these conversations, I feel really excited for our future and really excited about you as the leader to bring us into that future. So thank you so much for spending some time with me and with everyone here.
Thank you. It's hard work ahead, but it is so within our power to do it together. So let's build Vermont together, Angela.
Yes, I love it. Thank you so much, Aly.
Thank you. I almost went into the problem and then good bloopers. I love a blooper. All right, let's do that beginning a little bit again.